Hello, I am Dr. Loren M. Hill, your academic career advancement coach. And I am so happy to have with me today my good friend, Dr. Danielle McCamey. So let me tell you about how fabulous she is. So she is the Assistant Dean for Clinical Practice and Relationship and Assistant Professor at Johns Hopkins School of Nursing. She also practices in clinical surgery, clinical care surgery. She is the founder, CEO, and president of DNP's Color of Color, a 501(c)(3) nonprofit organizations that builds community for nurses of color through networking, helping them with career advancement. And she's also a longtime supporter of those who are in the academy, students. She mentors them, people who even want to go into doctoral programs or even just the field of nursing at large. So I love nurses, and there are a lot of us who do. So I'm so happy to have her on my podcast today and be able to share with you her experiences of being in higher ed, of being a leader, her journey into higher ed, some of the challenges that she has faced, and then, some of the sort of highs of being in the academy. So thank you so much for being with us today, Dr. McCamey.
Thank you for the invitation to be here, Dr. Hill. It's such an honor and a pleasure.
Very good, very good. So let's just start with your experience in the field of nursing. And you are a scholar practitioner, which, some of us are that as well. But wow, the field of nursing and in the academy. So what is that like for, a woman of color and someone who has really all of your pedigree and accolades? I'm sure it has been a breeze, right? You just waltzed in and everybody was so happy to see you, and you have had career ascension without any roadblocks, right?
Oh, yes, absolutely. But just to give a bit of background from my nursing career, I started off as a traditional student, meaning from high school to a 4-year college to get my bachelor's, and then advanced on to get my master's in advanced practice with a specialty in acute care. So I'm an acute care nurse practitioner. So I work in surgical critical care. And then my trajectory went toward more healthcare executive leadership. So I served in that capacity for a couple of years and then stumbled into the academy. Basically got super burnt out during the pandemic, serving in the ICUs at the height of the COVID pandemic. And healthcare leadership was it was an interesting time to be a healthcare leader. So that added to more burnt out feelings, moral distress. So wanting to pivot to do something different and had the opportunity to explore academia and literally launched into academic administration, fresh from clinical practice as the assistant dean for initially started off as clinical practice, but now new title. I am the assistant dean for strategic partnerships. So that's hot off the press. So it's been thank you. Thank you so much. It's been an interesting journey, just the learning curve itself, because throw me any healthcare system, anybody's ICU, I got you. But the academy, different culture, different language, different players, different levels of understanding, lots of strategy that you need to be equipped with coming in the door, which I kind of discounted, but I have a bank of mentors that are academicians, have been in the academy for a long time, that they gave me briefings. And I just was like, you guys are really like training me like I'm going into like war.
Right.
Now, it can't be that difficult, but looking back, having completed my first year, I remember like moving into my second year, that training and that level of preparation was definitely necessary, because honestly, I don't think that I would have been able to be as successful as I've been without having that boot camp knowledge experience coming in the door.
So interesting that many times we, particularly those of us who are people of color, have what one of my earlier guests, Dr. Patricia Arredondo, referred to as a nonlinear path.
Yes.
Right. So it can be, in her case, she did sort of go straight through, but it was non-linear in terms of the positions that she held. And then ultimately there was a situation that happened where she kind of pivoted out of the academy, not completely, but had to be thinking very strategically. And when we have these instances of non-linear careers, if you will, whether that's coming into the academy directly or, you know, vice versa, coming from industry into the academy, it really is interesting to me and not lost on me that we do need support, right?
Absolutely.
And so you had a team of mentors, support, a community that were able to give you some insight into higher ed. Now, you obviously had skills, dare I say, mad skills, because you were in the healthcare industry and served as an administrator. But people don't always realize that from industry to industry, there could be nuances
Absolutely.
that unless you have a guidebook or a guide, then you may have some challenges.
Absolutely. 1000.
So you made it, and you have even made some interesting strides where you are. I know that you have some initiatives around diversity, equity, and inclusion, and some other areas as well. And I really am proud of the fact that there was a bit of a title change and included strategy, right? Strategic, because I know that unless it's in the strat plan or there's some strategy around it, it could be difficult to move concept to execution. Has that been fair to say with you there?
Yeah, definitely. That was one of the things that I noted that's different from coming from a healthcare system where this is your job description and it encompasses a whole vast of things and there's no question. It's pretty clear. Academia, there's more art interpretation of your role and not necessarily clear metrics
Mm,
that are made known.
mm,
So sometimes you might miss the mark, but
mhm,
those metrics weren't necessarily outlined clearly. Or there's these expectations that may not have been communicated as well. So
right.
it's interesting navigating the abstract aspect of academia, especially in the administrative role. So that's been interesting navigating, but the transition to strategic partnerships has really been good. It's been basically like a month and change, but it aligns with my skill set of the network that I have with my nonprofit, and then just my Clifton strengths. I'm a relator, so I'm able to get a lot of different people into the room to have conversations about our mission as a school and initiatives and get them to want to buy in, to join in on what we got going on. So it's been interesting. So this one's a little bit more, I don't want to say a little bit more, but the shift to this role has been more alignment with where my skill set is.
So interesting that you have Relator in your top 5. I do too, right? Surprise, surprise. But but what I like about the fact that you're mentioning, the Clifton strengths, which I fall to often, like I have, they're right there on my bookshelf for
Oh,
those,
nice.
it's right there, right? So the great thing about it, because those of you who are longtime listeners and for those of you who are new, I'm all about assessments, right?
Yes.
They're important. I think when used correctly, they can help us immensely. And so one of the things about Clifton Strength Finders is that it sometimes coaches will kind of poo-poo it, but what I like and appreciate about it is very strengths based, right? So that's why its strengths is in the name of it. And
Mhm.
so although we all have areas where we have strengths in, like we really thrive and strive in these areas, and then we have areas that we're like, I'm not so much. It's not seen as a deficit or a weakness. So the fact that you now have a job title on paper that matches your strengths, I'm sure helps you in terms of goodness of fit, right? And so many times when I'm working with people, I'm like, is this place even a good fit for you? Maybe it is, and maybe it isn't, but is your job a good fit for you? And if it is, you're more likely to have successes or wins, even when there are things that, like you just mentioned, like unspoken, like I didn't know that I was supposed to do that. Was that a deliverable? And what rubric or metrics are you? I didn't know that was going on. But if this is in your wheelhouse and it's your strengths, then although it's unspoken, you will be able to deliver some wins.
Absolutely.
So let's talk a bit about how you have been able to survive in the academy. I know it hasn't been long, but you are in a pretty you're at a prestigious university, you've got a leadership position, and it's not lost upon me that you are still there. And so you doing right, and how can somebody learn from, you're like, yep, do this, yep, do that, maybe not do that. And you started with talking about getting your wise counsel together, right?
Absolutely. You definitely have to have a crew. And so for me, I think my crew is about 6 individuals that are deans at different schools. And they're a good mix, but most of them are Black women deans. And they've been very instrumental in ensuring that mind, body, soul are intact because
Yes.
it is taxing, in my case, being the only Black woman dean on the leadership team,
Mm,
and then being junior as faculty, and
right,
then being the youngest on the team of
right.
leaders as well. So there's multiple, and then, there's so many different layers that have been essentially questioned or utilized to try and compare the value that I'm able to contribute. And so having the bank of mentors to remind me of my experiences, the training that I've had, and then my ability to navigate has been very helpful to push through some of the obstacles. And
Mhm,
then also doing a lot of observing, like literally my first 60 days in the role, I met with anybody that was everybody or anybody that had some weight in the institution, and
mhm,
just did basically 20-30 minute talking sessions and just allowing them to just share about their experiences. also give me intel on who's who and who ain't who, and then just give me opportunity to exchange energy, because I'm very intuitive and I have a high level of discernment. So
Mm,
that enabled me to be able to pick out for myself, despite the words coming out of people's mouth, who
mhm.
was who and who I could basically utilize in certain ways to get certain things done. Because I knew coming in the door, I was going to be racialized.
Right,
Folks going to see my fro,
right.
and also just my age and just my
Yes.
non-traditional pathway in arriving, because from their perception, you just arrived here.
Sure.
Just discounting my 20 plus years of being in the game, me being a whole CEO of an international nonprofit with
Mhm,
2,000 members.
mhm.
So them not seeing the depth and breadth of my experience and the things that I have to contribute. So I already knew coming in the door, and then my mentors also gave me language to utilize, because the language is completely different
Yes, it
in
is.
the academy from clinical practice.
Yes.
And so having those pieces to create your strategy of how you're going to move. So
Yes.
I spent that 60 days looking, listening, and feeling. And
Mm,
then I had literally 2 journals that I took notes, 2 journals that after my 60 days, I reread all my notes, and I just like chess. These are my pawns, these are
yeah.
my rooks, this is my bishop, this is the king of this is the queen, and
Love
just literally had my chessboard of players
it. Mhm.
in this game of the academy, and I just moved myself accordingly.
Yeah, that is amazing. I really, really appreciate the sharing that tip about observing, right? I think that oftentimes because of the way that we move through the world, we are we're doing two things at once. We're observing and reacting, right? And so, and anticipating, like, oh, okay, this is what's coming. And so, being able to do your talking tour or listening tour, right? So, you're listening, they're talking,
Mm-hmm.
you're introducing yourself,
Yep.
you're making it you're approachable,
Yeah.
right? You're approachable and you're approaching and people are approaching you. I will never forget, I had a new dean of academic affairs at one of the institutions that I was working at. And I was sitting in my office in the research institute, and I was buried in some grant or something that I was doing. And it was like the end of the day, hardly anybody was around. And then this person comes walking up, just strolling, comes into my office, and I look up and was like a little taken aback, like, oh, I didn't think anybody was here. And he was like, hi, I'm Dean so and so, and I heard that you are really innovative and people respect you. And I was like this because I had never had a dean come to my office at any campus, right?
Mhm.
And this was not just some walk down the hall type of thing. This was, he had been intentional about this.
Oh.
And the reason that it was even more, like I was so stunned by it, because I was at a PWI and he
Mhm.
was that.
Mm.
And he was genuine. And the whole time he was there, he would, call me in his office and be like, what do you think about this? And I was like, this is amazing. And so he stands out to me to this day. And that had to be like 15 years ago. And I think that one of the things is that nobody does that, right? Or I
Yeah,
should say it's rare that you would
absolutely.
have a leader that sort of walks the campus. Now I get everybody's busy.
Mhm.
You don't have time to be strolling here and there. But even if you did that with some key people, and you would know those key people if you did this like listening and talking tour, like,
Mhm.
what are people saying about this? For you make your own, you come to your own conclusions,
Yep.
right? But it's a form of engagement. So I really, really appreciate you sharing that observation tip with us.
Mm-hmm.
So what's next? I know you've got some ideas in mind, and I know you can't tell us everything, but what do you and I had a previous conversation about sort of legacy and succession planning, and you're nowhere near that because you just got there 5 minutes ago.
Literally.
But when I'm working with people, I encourage them to think about their exit plan, because when
Absolutely.
they are going to exit.
Mhm.
So what do you see? You have run a company, you continue to be very, you're a thought leader, your imprint is very large.
Yeah.
And so because you're a strategic thinker, what will be sort of next in terms of your legacy at Hopkins, in nursing? Where do you see yourself going, and where do you see sort of the bigger picture?
Yeah, so the bigger picture is going to be around my passion, which is my nonprofit that focuses on nurses of color that are in pursuit of their doctorate in nursing practice. And this work focuses on nursing workforce development and diversity. So that's where my superpower is. And that's where I know when I'm speaking in that energy or that space with that community, the impact is tremendous.
Right.
But what feels good right now and what's also mutually beneficial for me for my career and then also for the nonprofit is me being in an academic space. With academia, there's a network of folks that's very unique because people have a foot. The things that I love about academia is nobody's checking for you, boo. Like, I don't know if that's because I'm in administration and, but the autonomy of your time is amazing.
Yes.
So you get the opportunity to dabble in things that are aligned with the mission of the school and the academy and other things that are amazing. So being out in the nursing practice world, I love, and then having the foot in the academic space to be present in understanding the value that brings just for our students of color.
Yes.
I actually had a student yesterday pull me to the side and was like, I am just so grateful you are here, because when I think about times when I feel like I can't do it, I look to you and I see that you are the only Black woman dean rocking your fro at meetings. And I can only imagine the hits, the blows that you're taking to stand, to clear a path, to open up a door for the rest of us. And I just grabbed my heart like, thank you for seeing me. And thank you for sharing that you recognize the energy needed to be in this space and that you're drawing from that as inspiration to keep pushing. I said, you have no idea how much that means to me and how it's literally rejuvenated and validated the commitment that I've made to being in this space, because you have to, as a Black person, as a Black woman, as a highly educated young Black woman in an administrative academic space in a predominantly white institution, you have to sit with yourself and have a conversation and accept the fact that you have all these layers that aren't going to be accepted in this. And you have to sit with yourself and accept that there are going to be blows that you are going to have to withstand. There's going to be stress. There's going to be trauma. There's going to be haters, but there's also going to be triumphs. There's going to be many successes. There's going to be moments where you have that inspirational talks with the students that you represent, the communities you represent, but you have to accept that this is going to be the experience if I want to be in this space. And so those moments give me life. But to go back to the question, what's next is I imagine that I will keep a foot in the academy because of the value and the ability to make an impact more upstream and see the manifestations in the nonprofit space where I'm seeing the clinicians, I'm seeing the leaders, I'm seeing the other faculty pieces. So, but I imagine that me having more of my time, energy within my DNPs of color work.
So, oh my gosh, you said so much that I was just like, yes, you know, when I wasn't vocalizing it, I was shaking my head. Because you're right, we do take a lot of hits, and even though we have our armor on, whether that be prayed up or, you know, crystalled up or
Right.
ancestored up, or
You need all of it.
you need that and some,
Okay.
right? Need the auntie, the mama, like everybody, everybody got to come
Let's
in.
go. Yeah.
This meeting with me today. Like, I need everybody, and I'm going to take my beverage with me so that during those times where I think I might want to open my mouth, I'm gonna put my cup up to my lips and be quiet.
Okay.
We use that as a strategy. And so
Yes.
it's important for us to be in these spaces.
Yes.
As you know, this student pulled you to the side and got in your ear with the feedback. Those are the times when we know that we are needed, right? To advocate for those who can't be at the table and in the room. And so it is a burden, but it can be joyful. And I also am very much subscribing to your principle of being in the academy and being in industry, right? Because there are ways that you can do that successfully, reap the benefits of both.
Yeah.
And so being in the room, being an administrator, helping to craft policy that's going to impact, like, you know, entry, enrollment, access, programming for students who are otherwise on the fringes or marginalized or not even recruited. That's a whole nother podcast. But the fact that you are there and supporting those that are there now and those will come in the future, and, you know, sort of this other side of the coin with you in the community with people who are interested or may not have even thought about it. My sister-in-law is actually a nurse, and I was like, you should get your PhD. And she's like, girl, I'm tired. I'm like, okay, we'll talk about that. But
I'm gonna go back to get her DNP.
It's like we gonna keep the conversation. But these areas that people don't traditionally think about, and even, dare I say, people of color who may not know, they don't think about it because they may not know about it.
Exactly.
So it was certainly top of mind for me to have you on as a guest, because you know, STEM and STEAM, it looks different to different people. Absolutely. But sometimes you can get narrowly focused on that, right? And so I thought it was important to have you as a thought leader in this space on to share your insights with our audience. And I so appreciate it. And I wish you the best.
Thank you.
And you know, you can't get rid of me. And so
well, we already talked about some initiatives before getting on. So, you know.
Yes. And this is, you know, this is what it's all about. It really is about community network, supporting each other. So in those times where we are facing challenges or feeling lonely, or like, can we take another day? We can call our sisters, we can call our brothers, we can call our people, we can call our comrades, our allies, and be, sort of filled up enough to get in there and do it at least one more day.
Amen, sister.
So much, Dr. McCamey. This has been a great conversation, and I'm sure that our listening audience has enjoyed you as much, if not more than I have. So I am Dr. Loren M. Hill. I am your academic career coach, and I look forward to meeting up with you again soon.